Hi, I'm Catherine Jacobs, estate planning and elder law attorney with Warner Norcross and Judd, and this is a Medicaid Moment. Thanks for joining me. In these videos, we talk about long-term care Medicaid for older and disabled adults. Today's video, we're going to talk about nursing home Medicaid. If you haven't seen the two other videos about Medicaid waiver and PACE, I encourage you to watch those. There are 3 programs that help pay for long-term care specifically. And today is the third about nursing home Medicaid, but it really is important to understand about the My Choice Waiver and the PACE program because those are great programs, offer some great alternatives, especially for people who may not want or need to live in a skilled nursing facility. But for those who do need skilled nursing care, let's dive deep. So the first thing I want you to know is that every community out there where older or disabled adults live are not nursing homes. And they are it's important to know that because they are different in the types of care that they provide and also the programs that they can use to help pay for care. So for example, I will have a client sometimes call me and they'll say, oh, my mom's in the nursing home and we can't afford that. We need to apply for Medicaid. And when they tell me the name of the community or we call the community to find out, it turns out that they're not in a nursing home, but in fact it's an assisted living community. And so in that case, we're going to have to look at whether or not we can apply for the My Choice Waiver program. And if you've seen my My Choice Waiver video, you'll know that not every assisted living participates in the My Choice Waiver program. So first and foremost, when you, for example, are in the hospital and you maybe can't go home, and you're going to be discharged to a community, it's important for you to understand, is this discharge planner helping you get discharged to an assisted living community or a skilled nursing? Because it is going to impact how you're going to get help paying for care. And let's just, for a quick example, in the assisted living, if you can apply for the My Choice Waiver program, that particular program doesn't pay for the whole cost of care and room and board. So for example, if you are an assisted living community and the monthly cost is $6,000, you may have $1,000 in income. The My Choice Waiver may pay $2,000 a month and there's a $3,000 balance. That is going to be solely the responsibility of the person living in there. So technically out of pocket, in my scenario, that's $4,000. And oftentimes when people are being discharged from the hospital or from rehab, it's a very quick process and people aren't fully understanding where they're being discharged to. So take a pause. Make sure that you're asking questions. Where am I being discharged to? Is this assisted living? Is it skilled nursing? If it is assisted living, is it an assisted living that does participate with the My Choice Waiver so that you know what your funding options are going to be? But let's get into nursing home or skilled nursing care, the third Medicaid program that we're going to talk about on these videos. Skilled nursing Medicaid works like this. So I'm going to give you an example. Let's say that I am discharged to a skilled nursing facility and I need to reside there and it looks like it's going to be, a long-term placement there. And I did just, as an aside, I went back and I looked at all of my nursing home clients in 2025 and just added up what is their daily rate and came up with an average. And it's just over $400 a day for skilled nursing care, 2025 West Michigan. Obviously, it's different depending on what geographic area you're in, and it changes every year, obviously, but it's a good rule of thumb, and we're going to use that number for our purposes. So if it's $400 a day, that's about $12,000 a month, $144,000 per year. For a lot of clients, that is not a doable number. They're just not going to be able to pay that. Or, they may have the resources to pay that, but they may have a spouse. And if we use all of the money to pay for the care for the person in the skilled nursing, we're going to totally wipe out all of the savings for that at-home spouse. So that's when we talk about what is the balance and how can Medicaid come in to help support that couple that it might wipe out all their savings or that single person who just can't pay for care. So we're going to put me in the nursing home and we're going to assume that I have Social Security of $1,060 a month. In that scenario, I'm going to have a patient pay amount. my patient pay amount is going to be $1,000. Medicaid says, Catherine, you pay $1,000, you can keep $60, and we Medicaid, we're going to pick up the rest. Let's presume, same scenario, I'm in the nursing home, I have $1,060 in Social Security, but I also have $1,000 that I get every month in a pension. In that scenario, I'm going to be required to pay $2,000 a month. I get to keep my $60. Medicaid is going to pick up the rest. Let's do another scenario. Let's say that I have that $1,060 a month in Social Security, but let's say that I also have a long-term care policy. And let's say that that long-term care policy will pay for skilled nursing in the amount of $3,000 a month. In that scenario, if I'm residing in the skilled nursing, I'm going to pay my $3,000. I'm going to pay I'm going to pay my $1,000 of income from Social Security. I'm going to pay the $3,000 that my long-term care policy pays, so $4,000. I get to keep my $60, and then Medicaid is going to come in and pay the rest. Medicaid is always the payer of last resort. Now, if I am married, let's go back to me just having Social Security of $1,060 a month. If I am married, Medicaid is going to say, well, wait a second, Catherine, before we say you have to pay $1,000 a month, we're going to apply a formula to your income and your spouse's income to see if you, Catherine, can be allowed to pay some of that income over to your spouse. Because what they don't want to happen is they don't want my spouse to be left in the community and the house we shared, for example, and not be with my income where they can't afford to live there. So there is a formula to see. And so let's say that based on the formula, it comes out that I can contribute $500 of my income to my spouse. In that scenario, Medicaid would say, okay, Catherine, you pay $500 to the skilled nursing facility. You pay $500, contribute that to your spouse so your spouse can continue to live in the community, pay their bills, pay the mortgage, pay the homeowners association if we're in a condo, whatever that is. And then I get to keep my $60, and then Medicaid is going to pick up the rest. So, oftentimes clients panic, and sometimes it'll be that the person in the nursing home has the higher income and someone's really worried. They may say, hey, I was a stay-at-home mom. I never really worked that much. My spouse was the earner and they're making all of the money. My Social Security is so low. How am I going to afford to live? In those scenarios, typically income from that Medicaid spouse is going to come back to the spouse who's living at home, who we call the community spouse, so that they too can continue to pay their bills and not totally have to move out of their home. So that is really, there's not a lot to nursing home Medicaid. It's just if you qualify, you pay your income, you do that calculation if there's a community spouse, and then Medicaid is going to pick up the rest. Make sure you come back. We're going to have videos coming up that are going to talk about how do you qualify for these Medicaid programs. There are asset tests, income tests, and so we're going to talk about how those all work. I appreciate you joining me here today, and I look forward to seeing you in our next video.